One of the laboratory tests that are used often in medical practice is represented by ESR or erythrocyte sedimentation rate. Let's review this one in many slides. As introduction part, the erythrocyte sedimentation rate, also known as sedimentation rate, SED rate or ESR, is a common hematology test that may indicate and monitor an increase in inflammatory activity within the body caused by one or more conditions, such as inflammatory activity, autoimmune disease, infections, or tumors. The ESR is not specific for any of the diseases, but is used in combination with other tests to determine the presence of increased inflammatory activity. The ESR has long been used as a sickness indicator due to its reproducibility and low cost. Over many decades, several methods have evolved to perform tests. However, the reference method for measuring the ESR proposed by ICSH or International Committee for Standardization in Hematology is based on the findings described by Westergren a century ago. So a Westergren method measures the distance at which red blood cells in coagulated whole blood fall to the bottom of a standardized upright elongated tube over 1 hour. Gravity tube and erythrocyte sediment and formate so-called difference between plasma and erythrocytes. Pathophysiology part, the ESR or erythrocyte sedimentation rate test measures the rate at which the red blood cells or erythrocytes in a sample of whole blood fall to the bottom of the Westergren tube. This process of falling is called sedimentation. Red blood cells typically fall at a faster rate in people with inflammatory conditions such as infection, autoimmune, cancer, malignancy. These conditions lead to an increase in the number of proteins in the blood. This increase causes red blood cells to stick together and settle in at a faster rate. A group of red blood cells that are clumped together will form a stack called the Rowley, or plural is Rowlokes. Rowlokes formation is possible because of the particular discoid shape of red blood cells. The flat surfaces of the red blood cells allow them to make contact with other red blood cells and stick together, which become more weightier and going faster to sedimentate or to the bottom of the tube. Normally, red blood cells have negative charges at outside of the cell, which causes them to repel each other. Many plasma proteins have positive charges and can effectively neutralize the negative surface charges of the red blood cells, which allows the formation of the Rowlokes. Therefore, an increase in plasma proteins present in inflammatory conditions will propagate an increase in Rowlokes formations, which settle more readily than single red blood cell. So, Rowlokes formation is affected by the amount of immunoglobulin and acute phase proteins like prothrombin, plasminogen, fibrinogen, C-reactive protein alpha-1 antitrypsin, haptoglobin, and complement proteins like cytokines. Other conditions are related to pathologies of the red blood cells. For example, polycythemia, an increased number of red blood cells, will increase blood viscosity and can cause reduced ESR. Because the reduced rate at which red blood cell Rowlokes will settle to the bottom of the Westergren tube. Reduced ESR, more viscosity, are related to a lot of or increased number of red blood cells. Some hemoglobinopathies such as sickle cell disease can lower ESR due to the abnormal shape of the red blood cells that impair Rolex formation, and spherocytosis, which have decreased ESR, as well as form of sphere in time of aplatissated hemoglobin or disc shaped. How the procedure is done? The Western Korean method involves a simple blood draw that should be taking only a few minutes, especially 1 or 2 minutes to obtain it. A phlebotomist or any type of health care professional will obtain the blood sample, will transmit it to the laboratory, and their blood is typically collected in a blacktop ESR vacuum, which contains 3.2% of sodium citrate anticoagulant. The sample must be in its own tube and cannot be combined with other tests due to the volume required. So transmitted to the laboratory technician, which will transfer the anticoagulated whole blood to a vertical test tube or Western Korean tube. To a vertical Western Korean tube, vertical position, which is inserted into the vacuum tube. When this sample is allowed to stand in the vertical tube for 1 hour, the red blood cells will slowly fall to the bottom due to influence of gravity. This will leave a clear straw-colored fluid at the top of the tube. This clear fluid is called plasma. The portion of blood that remains after the red blood cells and other cellular components have settled to the bottom of the tube. So the test result will depend on the amount of plasma at the top of the tube, which will be measured after 1 hour. Any of these conditions can interfere with result and can affect the result, like room temperature, time from specimen collection, tube orientation, inclination, which can be placed not perpendicularly but in any position like this of different grade, vibration, direct sunlight. How do we interpret the results and clinical significance? So you see males and females differences, less than 50 years old and more than 50 years old patients, and children which have a different normal range, like less than 10 mm per hour. Importance of the test. So elevated ESR level should heighten suspicion of a potential underlying illness like anemia, arthritis, infections including bone and joint, kidney disease, low serum albumin, low protein. Albumin is a normal protein. SLA, autoimmune, lymphoma, multiple myeloma, defective proteins, polymyalgia rheumatica, red blood cells abnormalities like spherocytosis or sickle cell, rheumatoid arthritis, systemic vasculitis, thyroid disease, Waldenstrom, microglobulinemia, and any process that elevate fibrinogen like pregnancy, infection, diabetes mellitus, end-stage renal failure, heart failure, and malignancy. And the last line is extremely high ESR level, like more than 100 mm per hour, which is equivalent or could be equivalent with infection, multiple myeloma, Waldenstrom, microglobulinemia, temporal arteritis, polymyalgia rheumatica, and hypersensitivity vasculitis. So if you have a patient with more than 100 millimeter per hour sedimentation, you should suspect any of the diseases accounted here. And of course, you indicate additional testing of the patient to confirm the disorder. Once again, this test indicate only inflammatory process and is not specific for any type of the disease. For confirming the disease, you should do additional tests. Have a great time.